Not much better now that you're here. We were having a two-way conversation earlier.
Let's see here. Are you able to see me yet?
Not yet.
Hey,
No.
You're on.
Okay.
how are you, sir?
Doing well. What happened?
I had a little basal cell removed today.
Okay.
So I was just trying a new look, you know?
Try to cover up plastic surgery. Don't
That's right. I'm getting a nose job, just one side at a time. It's an installment plan.
Okay. All right.
I'll get a little of this next. Yeah. Uh-oh. A competing Midtown Memphis Rotary Club. And I'll let that be Dustin. Renee.
Hey, how's it going?
Good. So how are you doing?
Pretty good.
Got a lot of folks coming in.
Everybody just got off work.
Apparently, yeah.
Yep.
Good evening, everyone.
I can call from my phone to make it sound like more.
Good evening. I see a phone number that's dialed in. It's a 553 number. If y'all don't mind telling me who it is, I'll put your name on the screen.
Hey, it's Mary Lenoci.
Hi, Mary.
Oh. Hey, Mary. How are you?
Oh, hi.
This
Elaine
is-
gave me the invitation.
Mary, this is Nizar.
Hi, Nizar. How are you?
How are you? So Mary Lenoci is a mutual friend with Ellen.
Great.
Carl, on.
Nizar, have I got her name spelled correctly?
It's Lenoci, correct?
Okay.
Yes,
Thank you.
yes.
Hi, Dustin.
Hey,
Hello, everybody.
Hey, buddy.
Hello.
Yeah.
Hey there.
Will, what's going on with your nose?
I had a little skin cancer taken off today. So it just,
Oh, good. Good riddance.
that's all. Yeah, exactly. I told them I'm getting a nose job on installments.
Well, I'm going to wait and see the results because, you know, I could use a little work here and there.
I can do a before and an after. Compare side by side. And Ms. Chafee, I can see your photo, but I want to say good evening. You don't have to turn your camera on, but I just want to welcome you since I think we've met. I mean, if you've attended one of our meetings before, but I'm not sure. And then Ben Jabbour, I'm not sure we've met either, but welcome.
Hello, Ben.
He's got his mic off.
That's fine.
Yeah.
That's fine. That wasn't a pressure move to get you to turn it on. Y'all are fine. If you want to leave it off, leave it
Are you
off.
sure?
Yeah, that's totally fine.
Yes, you are. I don't know.
Okay.
Sure.
Drew invited me, so I decided to sit in.
Glad to have you.
Welcome.
Welcome.
Good.
Thank you very much. It's a pleasure to be here.
Glad to have you.
And just to clarify for our guests, I'm the AV guy tonight. My name is Will McGriff. I'm a past president of the club, but I'm mainly just running the tech stuff. Our current president is Charlotte Hoyle. She'll be on in just a moment, I'm sure. And then our speaker tonight is Dr. Nizar Izza, who's also a member of our club.
Who's that, Mike up there? Hi, Mike.
Hi.
How did all the card delivery go?
They're still sitting in my chair. He had a pipe burst. Brian
Oh,
hasn't, I guess he's still, and he may have COVID too. I just got a brief on it on Sunday, so I'm waiting till
Oh,
he's
my
back.
uh-huh. Oh, gosh, I'm sorry. Oh, I saw him today, Brian. Our
Brian?
Brian in our club, right?
Yeah.
Yeah, I saw him. He's okay
Oh, good. Good.
now, but the pipes and stuff, we didn't talk long, but yeah.
Yeah.
I ran into him at the grocery store. It's exciting.
I was telling Will, my sister out in Collierville called like we're in a third world country here in Midtown because of the water boil order. She's at Kroger and I guess they have a lot of water in Collierville.
Gosh, here we are.
Yeah.
Well, friends who are in Parkway House still don't have water after a week.
Yeah,
And
I
that's
think,
high rise and
yeah, Kimbrough Towers is the same thing.
no water.
Ooh.
And a lot of older people,
Yeah,
very hard.
Eileen?
Hi,
yeah.
How are you?
Hello
good.
there.
See you.
Hi. Hi, Nizar. I also have a guest myself, Mary Lenoci. I see that she's connected.
Yes.
I thought
Denise
she would
just came
enjoy.
on.
Hi, Ellen.
Hey, thank you for joining, Mary.
Hey, and
Hello.
you're welcome. And Cindy's actually with me too. So
Okay,
you have
so
two of us.
it is Mary and Cindy, friend of ours.
Welcome, welcome.
Thank you.
Hi, Adele, I see your phone there.
I am.
It's
Yo,
good to
let's
see
see.
your phone. We miss you.
Drew's on.
Drew, hi, Drew. Good.
Hey.
Denise, hey, Denise. Neighbor.
Drew, I like your beard. Maybe didn't hear.
I think you didn't, yeah.
Well, Nizar, tell us while we're waiting. I know you've been unbelievably busy about people with breathing issues or whatever. Can you share a little bit about that?
Yes. In fact, before starting all the questions, I will review a little bit my experience with COVID-19 and how it affected my clinic. And then we can start the discussion and questions and answers. Yes. So I will describe what happened in my clinic.
Very good.
Thanks for the thorough email you sent.
Hopefully I didn't imply that you were going to talk about world peace or anything.
That's quite a broad spectrum of issues, but I'll do my best to answer. Fortunately, the cases are going down, so that's a good thing. So I'm not seeing as many patients with COVID-19 now as before.
You're seeing a lot less transmission from the latest statistics I'm seeing. That's a real positive sign.
Yes,
That's
yes.
terrific.
Well,
Yeah.
hopefully the new South African version of it is that they've already found one case, so that's a little scary.
Yeah, we've
Yeah.
had to put all of our South African trips on hold, and our son we just chatted with him in Japan, and the Marines, a lot of people have heard that 30% of our service personnel are turning down the vaccine, and everybody's wondering why.
Oh, my
Of course,
goodness.
there's no media that says, and the reason it's voluntary. When I was in the service during the Vietnam era, you had a choice of your left or your right arm, and that was it. Well, now because the vaccine's on an emergency basis, they cannot, the FDA hasn't given it full approval that services can enforce the vaccine, which is a shame because our guys and gals in the Pacific are all over the Pacific.
Yes. And they're at higher risk of catching these new variants.
Right.
Mm.
Yeah, Japan, just the last week or so, has started their vaccination programs, and they've got the Olympics scheduled for July. So it's a reschedule, I should say.
Yeah. Didn't they reschedule that already, the Olympics?
Yeah.
Well,
No?
it has been, it was supposed to be last June and July or July.
Mhm.
It has been rescheduled, and there's been I think the Japanese government would be very happy if they delayed it another year at the rate it's going.
Yeah.
China would be happy to step in.
Yeah, well, they can. Don't get me started on that.
How generous of them.
What do you think, Will? Should we go ahead and start or wait a little bit longer?
I think that sounds fine. I was just about to chime in and ask Charlotte what she wanted to do.
Elaine, Elaine's going to introduce Nizar.
Okay.
And do the Rotary four-way or
Oh,
anything?
you know, that's a great thing. I don't have my slide ready. If y'all, can we do it by memory? Are we?
Sure.
I bet Pan knows it by heart.
All right. Pan, can we kick it to you?
Pan, lead us.
Of all the things we think, say, and do, number one.
Is it the truth?
Truth.
Number two.
Is it
Fair
fair?
to all concerned.
Number three, will it build
Will build
goodwill
goodwill
and
and
better
better
friendships?
friendships.
And number four, will it be beneficial?
Beneficial to all concerned.
And for guests, that's said throughout the world.
Yeah.
All right.
Next.
Do you want to begin?
Yes, please.
All right. So I was given the task to introduce Nizar, and Nizar gave me his CV. Yes. So what can I tell you about Nizar? Nizar had started his education in medicine in Lebanon, where he comes from, and he joined the East Tennessee State
We're
University.
Lebanese too.
I knew from your last name, so.
I thought so. كيفك حبيبي.
He followed with his internship in internal medicine and residency in East Tennessee State University in Johnson City. And then he moved to Memphis at the University of Tennessee to do his fellowship in pulmonary and critical care and sleep medicine. He is currently board certified in, correct me if I'm wrong, pulmonary disease, critical care medicine, and sleep medicine. Correct?
That's correct. Mhm.
All right. He has several positions from what I can see on his CV. One of them is Chief of Staff at Forest City Medical Center. And out of the fun facts from Nizar, from what I can tell, is that he speaks English, Arabic, and French. So here you have it.
Thank you very much. All right. Good evening, everyone. Thank you for having me this evening as a speaker. The topic today is quite broad in range. And of course, I cannot address all of what Denise mentioned in her email, but I'll do my best. I thought to share with you first my experience during COVID-19 pandemic, how it impacted my practice. I'll try to be brief, and this is informal talk, so please feel free to interrupt if you have any questions. So we are already 1 year in the pandemic, and we just reached a grim milestone of 500,000 people who died from this disease. It's quite sad. When we went back in spring of 2020, this is when all started, we had little information about the virus. And we were hearing the news from Italy, in Europe, from New York, about how the healthcare system collapsed. And because of the lack of testing here, we didn't know how much the virus was already widespread. So in my clinic, we had to switch from in-office visit to telemedicine. I don't know how many of you did telemedicine follow-ups. It's a different thing. I don't know, some of my patients enjoyed it, some not so much. But the idea behind it was to avoid for the patient to come to the waiting room and catch the virus in the office. We had to use N95s for all my staff, nursing, receptionists. There was some question initially about the virus being airborne or not. Initially, there was some question mark about surgical mask versus N95. Luckily, I had enough N95 in my clinic since because I treat lung diseases, I may have patients with tuberculosis, TB, so I have to have N95. We canceled all sleep studies. I do sleep medicine. So as you know, with the sleep studies, we need to titrate pressure on CPAPs and BiPAPs, and that aerosolize the virus and it's a high risk. So we canceled all sleep studies. We canceled all lung tests, because with the lung test, they need to blow in a machine to measure their lung volumes, and that releases a lot of droplets. So it's a high risk. We started having a lot of meetings at the hospital to prepare. As you all heard in the news, there was significant shortage in PPEs, personal protective equipment. So we had to cancel all elective procedures. We had to assign roles who can intubate the patient, put them on the ventilator. So it was quite challenging to prepare for all of that. In my clinic, I didn't see too many back in the spring, relatively to what we dealt with later on. Mostly it was triaging patients, answering questions. There was a lot of anxiety about the virus, about what's going on. Unfortunately, during that time, a lot of patients delayed their care, being worried about coming to the hospital or to the office. I usually follow, for example, patients who had spots in their lung and they need serial CT scans. So some of them did not follow up. Some of my patients with lung cancer did not go ahead with their therapy, which is quite unfortunate for their disease. And you heard on the news about the initial treatment and what was offered for treatment for this virus with the hydroxychloroquine and azithromycin. And this was all based on few data, in fact, from France, and turned out to be not so effective in the end. So that was back in the spring. In the hospitals, in fact, in Forest City, we were seeing more patients from the jail. There's a federal prison in Forest City with more than 1,000 inmates. So most of the patients were coming from the prison. There was outbreaks all over the nation among inmates, and the CDC had to send several teams to try to control the outbreak in Forest City. We didn't know about the projection of how the cases are going to behave. We didn't know much about the data, especially what were known from China were not so accurate. So the projections were all wrong. We thought that after May and June is going to get better, but it got worse and worse. June, July, August.
If we could stay longer after this.
I had emailed them, yes.
This is when, in June and August, I started seeing more patients, especially after they've been in the hospital. The patient go into the hospital and they're needing a follow-up after the hospital. And this is when they describe to me their symptoms and what they went through. You're familiar with the loss of taste and smell among patients. You may not know that many did not recover that, or when they recovered their taste and smell, it was not the same. They would say coffee does not taste the same. There are all kinds of different symptoms, chest pain, burning sensation in the chest, shortness of breath, and some of these symptoms lingered on. I'm still seeing patients now that got infected back in March and April, and they're still suffering from that. You may hear about the term long COVID. These are the symptoms that are still persistent several months after the infection. Some patients who did not have any kind of lung disease ended up needing oxygen. So I was seeing them on oxygen. Some of them were able to wean off the oxygen after 1 or 3 months after the infection, but some of them are still on oxygen. Unfortunately, the virus caused so much damage in the lung. It caused fibrosis, scarring in the lung. And till now, they're still on oxygen. Then comes the fall and the winter. And this is where we saw the exponential increase in cases. The hospital here in our area got overwhelmed. If you saw it on the news, there was no ICU beds in Memphis. So all the smaller counties, smaller hospitals around had no place to send the patients that are on the ventilator. They had to keep them. So it was quite challenging as well. For me in my office, it was also hard to differentiate between, I have asthma and patient and COPD patients that have flare up during winter. So it was very hard to know Are they having COVID-19, or is it a regular flare-up from cold virus or infection? Initially, there was a concern about the flu season coinciding with the pandemic and having co-infection. Luckily, this did not materialize. The flu season has been subdued compared to before, and this is thanks to hand washing, facial mask, social distancing. So it worked on the flu. And we had a little bit of an idea about that from Australia. Australia had their flu season ahead of us, so we knew that the flu season in Australia was better than before, so we expected a little bit it's going to be the same here. And then this is in December, we started the vaccination, and thankfully the cases are going down significantly now. What will be the impact of COVID-19 on the long term? I don't know how long we're going to have to use face masks, maybe at least during traveling because of all the variants outside the US. Are we going to still avoid handshakes? Most likely people are going to be reluctant to greet using handshakes, and maybe needing annual vaccination for COVID-19 or boosters. As far as my practice, telemedicine, I think some patients, especially those who live far from my clinic, enjoy that service and they don't want to come all the way. So for some patients, it may be a way to do office visits. And the impact on other mental health is very hard to quantify. All these patients or people that stayed in lockdown for so long, it takes a toll on mental health. And not only mental health of people, mental health of healthcare workers. Being on the front line for a year, it takes a toll on some. I don't know if you heard in the news about suicide and depression and burnout healthcare workers. And finally, the impact on education. Kids' education, how did this online education gonna affect them down the road? So this is in a nutshell how it went through with my clinic. And with that, I will start answering questions if you have any. Go ahead.
Has there been
Hey,
any?
Nizar, it's me.
Go ahead.
Go ahead, Mary.
Hi, Nizar.
Hi.
So, Nizar, after you have a vaccination and you have the first one, because there's now uncertainty about the second dose, is it the first dose pretty good? I've seen information about the Pfizer vaccine being 95%. I think the Israeli study. So if you can't get scheduled, because I just read that Shelby County has such a conundrum on their hands, should you be concerned if you can't get your shot within the 3-week period?
You shouldn't be concerned. No, you shouldn't be concerned. So first, in the trial of Pfizer, they did the trial on 40,000 people. After the first dose, 12 days after the first dose, the effectiveness is about 52%. And then it goes up to 95% 1 week after the second dose. So that's the trial of Pfizer. Now, in the real world, there are studies in the UK and in Israel where it showed quite effectiveness even after the first dose. But if it's delayed by 1 week or 2, the CDC is totally okay with that. You shouldn't be that concerned about the delay of 1 or 2 weeks. And it's better to have the second dose for the immunity to last longer. And especially with the new variants, there's some concern about resistance of the virus. You know, the first dose, it will kick in your immune system. The second dose will boost it. And in fact, it can increase the amount of antibodies times 10 after the second dose. So it's very important to do the second dose. The UK opted to do the first dose only just because they want, as a strategy, to try to vaccinate as many as possible and try to curb the high transmission they had. Did I answer your question?
You did. I have a follow-up question to that, though, if you don't mind.
Sure.
Is there a theory that if you get the second dose in the other arm and you drink suffer all the, some people have, after the second dose, had some really bad reactions. It's almost like they have the flu or something. Is
Yes.
there any validity to that?
No. On the second arm, it doesn't make a difference. Several or a good number do have flu-like symptoms after the second dose. It's expected in the study, and it's just a sign of the immune system responding to the vaccine. So in fact, it's a good sign, and usually it goes away within 48 hours.
Okay, great. Thank you.
Sure, welcome.
You can.
Are the concentrations in both injection the same, 1 and 2?
Yes.
They're the same concentration?
Yes.
Okay, thank you.
Mm-hmm. Sorry, Pam.
I've had both Moderna.
Mm-hmm.
And after the first one, a week afterwards, I got a rash all around the site. So I went to my doc because I wasn't sure that a week later, everything was fine, except a week later I got this.
Yeah.
And she took my antibodies and I didn't have any. Okay.
Yeah.
After which I went, oh my gosh, I thought I was going to have 50% or whatever. So I got the second one and definitely had the flu-like symptoms for about a day. And then they went away. A little bit of rash, not as much. And I'm going to the doc on Thursday and see what the antibodies say.
Yes, so it is well described with Moderna. Have a lot of healthcare workers who tend to have more rash with Moderna than the Pfizer, but it goes away.
It was not bothersome. It wasn't particularly itchy. It was just took up a lot of my arm for about 10 days.
It was gross, really.
Okay.
Nizar,
yes, go ahead.
For those that haven't had the vaccine, will you cover what not to do, like not take aspirin and Tylenol and things like that prior to getting the vaccine? I've had it.
Yeah, so the CDC does not recommend using anti-inflammatory or Tylenol prior to the vaccine. They don't know how it's going to affect the immune response, but you can take over-the-counter Tylenol anti-inflammatory after the vaccine. It's okay. But not
I did
before.
that with Pfizer and had absolutely no symptoms or any contraindications.
Good.
Yes, I took the Pfizer vaccine about 2.5 weeks ago. I had no issues at all. I felt as normal as I usually feel after dose 1.
Mine, I had real sore arm. It was painful for me to sleep on that side of the arm, but it went away also in 24 hours.
Right. Yeah.
But other than that, nothing major.
So what mental health things, because you did a lot of relaxation with us the last time you presented. So how have you approached working with your patients in that way?
To be honest, it's hard for me to address mental health. Usually it should be if people are dealing with depression or anxiety, usually they have psychologists or psychiatrists or their primary care doctor that will be able to address this, but I do not treat that. But it's definitely made it worse for a lot of my patients.
Nizar, it's Mary again.
Yes.
I apologize. I have lots of questions. The mask situation, 1 mask versus 2 masks. Is there a good answer? What are your thoughts?
So I go by what the CDC is saying. They have studies that showed if you use 2 masks, the protection goes up to 80%. So I would favor the 2 masks, especially with the concern of the new variant. The CDC is concerned about the UK variant being more dominant in the US in the coming weeks, and they're worried about another surge from that. Hopefully, with the vaccination, it does not materialize, but it's a kind of race between vaccination and the spread of the UK variant. And for those who don't know, UK variant is much more contagious than the regular virus that we have now.
And so should the first mask that you wear closest to your face be like a medical mask, a paper type mask, and then you wear the cloth mask over the top of that? Is that the right?
Yeah, it should be the surgical mask. Then on top, if you would like, the cloth mask. And now there are more surgical masks available. So in the beginning, the CDC was a little bit reluctant about recommending masks for the general public because there was so much shortage for PPEs for healthcare workers. Right now, it's not as bad.
Thank goodness.
Okay, great. Thanks.
Welcome.
I have a question.
Yes, go ahead.
Hi. So in terms of, there's been information about increasing your vitamin Z, zinc, anything to boost your immune system. We know the basics like exercise, rest, eat healthy, thought management, stress management, those type of things. But does the added immune, like zinc and vitamin C and gut health probiotics do anything at all? Or is that like?
It was not proven. They studied that the zinc and vitamin C and vitamin D, but there is no proof of benefit. Now, if you're deficient in vitamin D, of course, need to supplement that. But other than that, there is no evidence of benefit. Yeah.
Nizar, you have a question in the chat box from Dustin. I don't know. If
sorry, I'm not following the chat, so.
Maybe Dustin.
Yeah, I could just say it.
Go ahead.
The state of Tennessee, they recently updated their distribution plan to not include the Shelby County Health Department. Instead, go directly to like hospitals and pharmacies to administer the vaccine. Does your practice have any plan in place to start administering those?
So the problem is the storage of the vaccines. I think they're shying away right now from the clinics to administer the flu and these shots. And the logistics are a little bit challenging as well, trying to see which patient got the Pfizer, which one got the Moderna, and have the intervals needed, 3 weeks versus 4 weeks. I think they're having Walmart and Walgreens, the big chains, that they have more staffing and more space and more capacity to help distributing the vaccine.
Thank you.
Sure.
Hey, Nizar, it's Angie.
Yes, Angie.
I was curious, is there any correlation between how severe the side effects are between ages of who get the vaccine?
Yes, the younger population tend to have more symptoms after the vaccine. So if I remember right, maybe 20%, and depends on which vaccine, but younger tend to have more muscle aches, headaches than the other.
Okay, good to know. Thanks.
You shouldn't be scared about it, though.
Well, I hate to admit this, all 3 of my 40-year-old children have had it, and they have suffered more than I have at my tender age. So he's absolutely spot on there.
Yeah.
I have another question. Is there such a thing as a herd immunity at this point? And are there people that are just never going to get COVID, either to genetics or blood type or anything like that?
Yeah, so the herd immunity is still not known exactly what percentage of the population to be immune. The estimate is 70 to 90%, if you're gonna give it, maybe 80%, but also depends on which variant is the dominant one and how contagious it is. The problem right now, we don't know exactly how many patients or how many people actually got infected. You know, we test, but for each one that we have a positive test on, how many are undetected? especially early on in the pandemic. The estimate was for each one positive test, maybe there are 10 people that we didn't detect. Right now, we're testing much more. So the latest estimate I've seen on the CDC is 4 to 1. For each one, there's maybe 4 undetected. So if you look, of course, the prevalence, how many got infection varies in the United States. But overall, I think what I've seen is the numbers between 20 to 30% already got infection. So you add to that the vaccinated, so I don't know, maybe we're at 30, 40% now, just a rough estimate. So there's some ways to go. And that's why the vaccination is very important, because the more we vaccinate, the faster, the less